welcome to episode 7 of the Confident Carnivore podcast. Today's guest is Stephen Thomas, or as we know him in the MeatRx community as Coach Stephen. Hello, Stephen. Welcome to the show.
Hi, Janice. Nice to see you.
You're looking great as always from across the pond. I'm so
Thank you.
excited to have you here today, Stephen. As we know in the MeatRx community, that Stephen is a wealth of knowledge regarding health and optimizing human performance. He has so many certifications and credentials that I can't even possibly begin to list them. But Stephen really is a great resource for us. We get to see him every day, 7 days a week. He's up on there giving away information, helping people to achieve their health and fitness goals as well. So before we dive into the conversation with Stephen, let's share a few. We're going to first share his actual before and after pictures. So you can see here, can you see my screen, Stephen? Pictures?
Yeah. Now, I must say, as I got fatter in my 40s and 50s, or approaching my 50s, I didn't like pictures of myself, which is why I couldn't. And this is doing a run at 50. So it shows that I was running. It's called the color run. And as you run round, they chuck dye all over you. So that's how ashamed I was, even though I was doing everything right and eating, healthily, lots of low fat, high carb, porridge and skim milk and all that, and doing running 3 times a week, and quite serious running. I was doing half marathons and time trials and 10-mile runs. I was getting fatter. So, and I just hated photographs. I hated seeing myself. So a lot of the before and after pictures that you've got are amazing, because there are people who've got those pictures of when they were really tubby. But this was one of the few photographs of me from that period where you can see I'm plumper, and I just was unfit, unbelievably unfit. So
shocking, because when we hear more about your story, you were doing so many hardcore athletic activities, and to actually on the high fiber or high carb, low fat, you were actually not, you were gaining weight all the while doing so much fitness. So what about this?
Well, this is when I was in my 20s, and I could have worked on my legs a bit harder looking at that photograph. But I did do a bodybuilding show, completely natural, by the way. So people that think, you need steroids to get big shoulders, I was quite happy with my shoulder development. And, that was just an amateur show. I'd been in and out of the gym quite a lot. Before that, in my teenage years, I was a semi-professional soccer player, or football player, we call it in the UK, but I'm saying soccer because most of your viewers are American. And, so I was naturally quite fit. I'd won the 800 meters. I had the 800 meter school record, and I found it quite easy to put on muscle. But even at this point, I was eating quite high carb and low fat. And I think one of the biggest problems that I have now at 56 and 57 in a couple of months is if I was talking to that person you see in that photograph, I wouldn't have believed what I was saying. It's only with age and then the constant damage, the low level of damage that carbohydrates did to me, becoming pre-diabetic and things we'll get into later. But when you're younger, you tend to be able to out-train some of the things that are happening in your body. And I certainly know that at that point, when I was doing the bodybuilding show, I 100% believed what I was doing was right. And I did look good, but of course the problems were already beginning to start. My teeth were terrible. I was getting cavities all the time, which is like one of the first things that happens when people go vegan and stuff like that. They notice their teeth deteriorates because of the amount of high carbohydrates they have in. So
wow,
I won't fast forward too far, but so that's why there's not that many pictures of me that I could have given you as a before, because literally I hated pictures of myself.
I know that feeling. And so we actually, if you do go on the MeatRx website, you can read more about Stephen's success story going from that high carb, low fat diet to the carnivore diet. And then Stephen is one of the most popular and top rated coaches on MeterX. He really does combine the way of eating with so much, a huge wealth of knowledge around fitness and, health. I did a session with Stephen, and Stephen, I tried to wear this, what I consider my muscle shirt for you today, because I wanted to show that my muscle, what you can see a little bit there, the muscle
Yeah, that's good.
we have, this
Mm.
is just from doing a few weeks of resistance bands that Stephen taught me how to do. And I actually love them. I've always hated exercise, but I really like doing the resistance bands because he taught me some simple moves that I can do. And, my left arm is a little bit weaker because I have a plate and 6 screws. And Stephen was really helping me to figure out how to kind of rehab my elbow because I broke it last year. And it really worked. And he taught me how to do a proper push up and a proper squat. And I'm just doing those few things. And it's like, I actually enjoy it now. So I just wanted to thank you for that, Stephen.
That's very
Um,
kind.
yeah, so he really does. When you meet with him, he'll very much tailor, you know, what your needs are. So both your fitness and your diet. And I think what I really liked is he was so positive and he breaks everything down to being really simple. And the thing you said about lifting a weight and when you're just preventing it from going down,
Mhm.
that shifted everything about how I do. And maybe you could talk about this more later, but it was just a mind shift of, it's like, I'm not trying to pull this little weight up toward my arm. I'm trying to prevent it with resistance from
Yes,
the earth. And
yes.
that, and he tells us things about how to, in his, you can see here, he offers the weekly muscle and health meeting on Thursday, and he'll teach you how to properly move your foot. If you have plantar fasciitis, all kinds of things. He's been telling people how to just do these minor tweaks to really, improve your performance. And these small things really help someone like me who really has resisted exercise and really doesn't like it, help to keep you having that really positive mindset. So I think that's one of your gifts, Stephen, is just really making things positive and simple for people. And
Mm.
then let's see, you also do on Wednesday, the weekly diabetes meeting, which it's hard to believe that as a high performing athlete that you were pre-diabetic, but we're going
Yes,
to hear more about that soon, right?
yes, yeah.
And then Stephen actually has 3 websites. Can you tell us what each one is? So starting with Keto Carnivore.
Well, you touched on it earlier. I have a lot of qualifications. So just for people to reference, the reason I do the diabetes meeting is I'm a specialist practitioner in the UK for diabetes and obesity. So I'm qualified in that area, and actually studying diabetes was one of the big turning points in my low carb journey. But anyway, so the most common question I get asked is, so what do you eat? So I deliberately did a website that basically is just pictures of what I eat to give people some idea. So there are some coaches that are very zero tolerance and they just want you to do beef, salt and water. And there's good reasons for that, especially if you have autoimmune diseases. So if you're coming to carnivore for sort of autoimmune issues or something that's particularly bothering you, you can be very forensic about what foods are bothering you if you do the meat, salt and water and then start reintroducing. But most people actually are looking to lose some weight or just feel better, or the mental clarity, or whatever they've seen on other podcasts. The real true stories, the anecdotes of people that have gone carnivore and improved many different issues. You can do that with quite a varied diet, and that's the idea of this site. Really, is just to show that you can have, cold ham there, roast beef. You can have fat bombs if you cope with dairy. Okay, so cheese. You can have ribs. You can have eggs. Obviously, I have some fish as well. So there's the fatty salmon there, a nice fatty fish. Milk and cream. Some people can't cope with dairy. Like I say, I'm okay with cream, but not as good as when I take cream out of my diet and I have butter in my coffee, for instance. So I was trying to show people that there are some things that you do. And there was just a few, just some of the graphs there where my muscle mass has gone up and my body fat has gone down, which
Oh,
conventional wisdom is that can't happen. You can't lose fat and gain muscle. Well, I've got over sort of 100 coaching clients that have definitely proved
wow.
that. And I still track my blood glucose. So people are interested in the blood glucose monitoring. And I actually do the glucose ketone index now with the Keto Mojo. So I do track that as well. And the blood glucose obviously ties in with the diabetes meeting. So people are interested in what I do, but also it makes it relatable because I was, like I say, pre-diabetic. I'm a qualified phlebotomist as well. So I do lots of blood tests. And because of my level 4 personal training qualification, I also do body composition. So it's all very interesting to keep all the stats. So the personal training side of things, that's a separate website if people want to, especially with lockdown at the moment. So we're in 2021 at the moment, so we're locked down. Most people can't go to the gym. So it's been really important to put some stuff out there for people to follow at home and some challenges. It's very corny, but if you don't challenge your body, you will not change. So you need to tell your central nervous system, this body that's walking around is going to be lifting some heavy weights, or it's going to be doing some very fast running or something, and we look at that as well. So there's fitness challenges, and one of the great things about coaching is people really get into setting targets and goals so they can do that. And it doesn't matter, you don't have to be a supreme athlete to start. You can go from not being able to do a push-up, and if by the end of the month you can do 3 really solid good push-ups, that's progress, you see. So it doesn't really mean that you can only come to that site if you're an athlete. It's all about starting from somewhere and improving. And the last thing is the optimal health thing, where people look at what I've just said and are trying to be a bit more holistic. So what is good health? Well, some people think it's being able to do daily activities, with definitions where you start getting benefit if you can't do certain things. Whereas for some, it's, mental clarity, that's their definition of health, having less anxiety. But, I'm very much, we need to look at everything. So your diet is obviously the first thing to look at, get your nutrition right, and then look at your movement in your joints and also your anxiety levels if you have problems in that way, and making sure that you rest and recover. Because there's a big difference between rest and being sedentary. Being sedentary is just sitting around doing nothing. But if you exercise, then you need to rest, and recover and repair. So that's the reason the three sites are there. One's about food, one's about training, and the third one's more about rehab and the mental side of things. So.
Well, that's really fantastic. Even the idea that you have the 3 websites is very representative of your approach, that you break things down into these simple pieces, very intuitive for people, and you make it this holistic experience and very accessible. So just seeing what you eat, you can see how delicious and varied carnivore can be, and that being non-dogmatic. I think of all the coaches, I've definitely noticed how you're like, keep it simple, keep it positive, and that mindset is what's going to enable you to, like you said, I started from no push-ups with my broken elbow, and I've worked my way up to maybe I'm at 12 to 15 on a good day, based on how you taught me to do it. So but let's dive into learning to how you got to where you are today. So first of all, Stephen, how old are you, and how long have you been carnivore?
Well, I'm 56, and carnivore will be 2 years in May. So I'm 57 in May, and at 55 I went carnivore. A big change, and a huge step, I thought at the time. And like many people, I was going to do it for 30 days, and then when I got to 30 days, it was so good, I thought, well, I'll do this for another month and then see how it goes. And 2 years later, I wouldn't go back at all.
Oh, wow. And so we've seen that you've been very athletic. It looks like you were doing bodybuilding in your 20s.
Mhm.
And you said you put on muscle pretty easily, but what was your diet like when you were, growing up and leading up into your 20s? What were you eating while starting to develop your athleticism?
Well, I I lost both my parents very young, and they were very much into sort of lots of fiber, and they didn't have much meat. And sadly, my mum had colon cancer, and she was eating a ton of bran. In Britain, we have bran flakes. So all the things that you would think would stop that, or you're told would stop that happening, didn't really help her. I'm not saying that is the reason, but there is possibly an association. My father died quite young as well. So my stepdad was my real dad's father. So genetically, I could see where I was going. So I was pretty fit and doing okay. And like I say, the 800 meters at school, I was really good at doing that. And tennis, I was quite good at. I won a local sort of singles tournament. The soccer, football, we call it in the UK, I did okay at, and I tried out for a semi-professional team and was playing for them for a little bit, but that didn't really suit me. At that age, I didn't want to be training and doing all that, taking it that seriously. I liked sport. I liked being competitive, but I didn't really want to be training. I liked the matches and those sort of things. But I think I was reasonably fit looking. But like I say, I should have noticed some of the things. Even now, I realise that my vision wasn't great. My teeth were atrocious. I clean my teeth and do all the proper things that you should do. And I was eating at a young age. I was eating skimmed milk and porridge and a freshly squeezed orange juice and doing all the things that I believed was healthy. Lots of rice, lots of pasta, and working out. And I enjoyed the gym the most. So like I say, when I was about 23, I did a bodybuilding tournament and I thought I looked okay. So if anyone had said to me, what you're eating is going to make you ill, I just wouldn't have believed them. And I can even remember going through a muscle and fitness magazine and seeing that some of the athletes were trying a high fat diet. I think Atkins was big then. And I can remember just immediately blocking it out and saying, well, that won't work, because it was so common that fat was bad for you, saturated fat was bad for you, terrible myth. But, we all believed it. And so my 20s, I think I was sort of out running or out training the way I was eating. And then in my 30s, I noticed that I started, however much I was doing and however good I was with my food, I was getting a little bit plumper and I didn't feel as good as I did. But I kept going, and it was quite a rude awakening, because I started to realize that my vision was deteriorating a bit, very early signs of cataracts, and I was getting some sort of GI problems, quite a lot of gas, which I'll fast forward a little bit. So into my 40s, it was becoming a real problem, and I started doing my qualifications to be a specialist in exercise and also in fitness. I was doing them hand in hand. So I did my personal training qualification, and then I wanted to go up a level. And the reason I did that is because I wanted to be on a list of exercise professionals that doctors could refer their patients to me. I wanted to be qualified for that. And I felt that would give me some kudos, so the people coming to me would think, oh, blimey, he's really very well qualified. So so doing the level 4 personal training qualification was really good. But then I started to put 2 and 2 together and realized that some of the things that were in the textbooks weren't really matching up with the other thing that I was studying, which was diabetes and obesity. And in those textbooks, buried deep within the textbooks, and I bought a couple of medical textbooks with me to show you, there was some clues where I was putting them together. For instance, when you dose insulin for a diabetic person, you dose it only in relation to the amount of carbohydrates they put in. So then I read in this book, I just show you the Guyton's medical physiology textbook. I've actually highlighted a phrase, and it says, all aspects of fat metabolism are greatly enhanced in the absence of insulin. So it's there. So I thought, well, that's interesting. So if insulin is being injected into these people, what they're saying is that will shut down the fat metabolism. And it's very stark. It's in that book a few times. And as you can see, I highlighted it. And I used to do talks, and I'd take that book out, and another one, a biochemistry book, and I'd say, it's there, it's known. The more insulin that's going around your body, the more fat burning is turned off. And then when you realize that carbohydrates are the thing that really do raise your insulin levels, you think, well, that seems to be a bad thing to consume a lot, because if you have less carbs, you'll have less insulin, so therefore you'll burn fat more. And it's there in the textbooks. It is in there a lot. So I started to rethink my own diet, and then there was a couple of things, and I don't think you know this, Janice. I know you did a coaching session with me, but I had a calcium coronary artery calcium score, which is where they look at your heart, and then they give you a grade of how bad your arteries are or how good they are. So a score of like 0 to 100 is pretty good. 0 obviously is about as good as you can get. So it means your arteries around your heart are quite clear. Then they grade it up by different hundreds, and over 400 you're likely to have a heart attack. That's just the percentage generally across the nation. If you're over 400, then your heart's in a bad way. So my score was 639, and I went into the scan saying to the radiologist, I'm going to have a terrible score because I've eaten a lot of carbohydrates, and I don't smoke, I don't drink, I've never done any of that, and I'm active. So all the thing, and all this, eat less, move more. I did all that, and I had this terrible score. I avoided saturated fats. Apparently that's the culprit, or that's the perceived wisdom. So anyway, the CAC score was quite a big one, and then I got lower left quadrant pain. Going back to when I said I had gas and things. So I had to have a colonoscopy, and having lost my mum to colon cancer, it was a big deal for me. So I remember sitting in that ward thinking, I'm doing everything. I'm doing everything I'm told to do, and everything that I've been trained to do. And here I am, coming up to 50, and I'm in a ward, and there were a lot of people being diagnosed with colon cancer. So I had to change things. I had to really change things up. And I knew if you look at that picture of me running, I was running 3 times a week. I was not eating anything that was apparently bad for me. I was doing everything, absolutely everything right. And there I was, complete state. So that was it. That was the kicker. And it wasn't me wanting to try and get my youth back, but I just thought it's a good time to start when I'm 50, and I will go low carb, and I will continue with the activities, because I think you can do sport. There was enough in the text and enough in my own separate reading to tell me that low carb wasn't that bad. And obviously there was a lot of people doing podcasts, and it was a little bit of a sort of surge at that point, over the internet. Obviously not on mainstream media, because that's all paid for by the food industry, and they don't want you to have low carb. They want to sell you supplements and cereals and all those sort of things. So I went low carb, and it was pretty instant. The difference is I lost some weight. I know initially it's water weight, but I lost a lot of weight. I started feeling better. There's a couple of things I haven't mentioned yet, but they all started to improve. The lower left quadrant pain went in my gut. The gas started to go. But it didn't clear everything up. I've been plagued with some niggly little things, like I used to get a big rash here very often, and I've always had athlete's foot. And that started to get less, but didn't go completely. So I thought, well, if I reduce carbs even further and try the ketogenic diet, so this was after a year or so of low carb, will that improve things further? And it did. So things really did start to get even better. My waist went as small as, when I was in my 20s, and clothes that I thought I'd have to throw out, I started to get back into. My strength started to improve. And then I started to, I did some few other qualifications. So I trained to be a phlebotomist, so I can take blood at the NHS and, have this qualification. So I started taking my own bloods. And then I got to 2019. So I got, coming up to my birthday, I took my own bloods, and then I decided, right, that's my baseline. Now I'm going to go carnivore. So I've got a baseline for where I was. Sadly, I didn't have all my bloods from when I first started the journey. So I got my testosterone and, basically the whole panel. I got about 120 different markers. And the reason I mention that is because one of the things about carnivore people that are anti this way of eating tend to say, oh, well, your libido will go down or your testosterone will be destroyed. And that's not true. That's definitely not true. My testosterone, now you've got to remember how old I was, went up by 30% within 2 months of going carnivore.
Wow.
You know, so a lot of people, a lot of men of my age, I mean, testosterone is important for women as well, but more for men. You know, they have hormone replacement therapies. And here I am, one of the major things that the male of the species wants to increase, the testosterone, is shooting through the roof. Within 2 months, it was incredible. And other things started happening, you know, the gas completely gone, which is a big surprise because you think that's normal, you know, to have.
I wanted to see them.
Oh, the body composition. So this is a 5-year. This is so this is the change summarized, a whole 5-year of my life. I do a body composition measurements every single day, which is a bit sad. And this is like a shortened summary, and you can see that at the beginning where it's high, that's my body getting used to low carb, and then it started to stall, and then I went keto, and then there was a blip up when I went to carnivore, and then a huge plummet in body fat, and that's made me very happy. I'm currently experimenting with dairy, as I think I mentioned earlier, and having a lot of cream, and it has put my body fat back up, which is an interesting thing because it's the only thing I've changed. Now, I lost all that body fat, and apparently you can't lose fat and gain muscle. And I think this is like the inverse of what you've just seen. So you can see that my training, and again, I want to emphasize, you don't have to exercise to do this. I mean, you can lose body fat and gain muscle just by changing your nutrition. But you can see my muscle mass went up, and then a carnivore just saw this huge improvement. So whether that was down to a bigger percentage of protein, I don't know. So there was my testosterone. So that was May 2019 to July 2019. So huge improvement.
Amazing. So the graph with the body fat and the muscle mass, what was the duration on that change?
That's a 5-year.
That's the 5-year. Okay.
Yeah, it's quite compressed actually. So, well, that's been a big thing. Before lockdown, I used to do like a monthly local meeting, and we'd get people in of all ages, and they'd try this way of eating, and we'd do the body composition, and we'd measure their muscle mass. And I would always, to show you something, I'd always explain that don't be too worried about the scales, because that's a pound of fat and that's a pound of muscle. Wow. So you might gain some muscle and you might lose some fat and weigh the same. And we did, this is to scale, this is pretty much correct representation, because people would come back and they say, I don't understand, the scale's not really moved much, but my trousers fit better, or my blouse is a bit loose, or whatever. So what it showed to me, and one particular woman I can remember, 77, and she came in after a month and she said, I've only lost 5 pounds. I said, but you look amazing. You look really good. And when we did the body composition, she hadn't lost 5 pounds of fat. She'd lost a lot more fat, but she'd actually gained muscle and bone. Wow. So bone density went up, and she didn't exercise at all. So that happened enough for me with various people of various ages, and obviously some male, some female, showed to me that when you're eating to satisfy your body with the right amount of nutrients and the right mix of nutrients, you will gain muscle and you will gain bone, you know, because most people are overeating but undernourished. You know, they're eating a lot of food, but they've not got the nutrients that they need to thrive. So we saw on average over a month a 12.2 pound weight loss. But when you look at raw weight, that didn't show how healthy people had become. And obviously some people had lost less than, I remember a couple of diabetic guys actually had lost like 18, 19 pounds. But that doesn't really tell you the story. Weight doesn't tell you the story only, because if you're improving your bone density, and you're improving your muscle mass, then I would say you're a fitter person. You're less likely to have falls and fractures, less likely to not be able to cope with the activities of daily living. So that to me was really interesting, and it was quite a cross section of society. And I think exercise is over emphasized for fitness. I think nutrition is the absolute foundation of it, absolutely. And I think the exercise is more for fitness and joint health and mental well-being as well.
Wow. And I was, people look at you, and when I looked at you on MeterX, I thought, okay, this person is working out a lot, right? I look at you and I think he must be working out every day, all day in the gym. And can you let me know what you actually, what your exercise actually looks like today?
10 minutes a day. I do a pull day I just do 4 exercises, and each exercise I do fatigue, only 1 set. So I'll do a chest press, then I'll do a tricep press, then I'll do a shoulder press, and then I'll do a squat. So all of those things are pushing exercises. They're just pushing exercises. So basically you do it until you can't do any more. That's your chest press. That's done. And you do those 4 exercises, and that's it, 10 minutes, and I'm done. And then the next day I'll do pull exercises. So, I'll do a deadlift, so you're pulling a weight up, or I use resistance bands and bicep curls, so you're just pulling. And then you've got a bent over row, so that's pulling, you're pulling something up. And then you do a calf raise, so you're pulling the weights off and raising up onto your calves. Again, 10 minutes. And then I do that on alternate days, and then I have 1 day off. So 10 minutes. And that has improved my muscle mass and reduced my body fat incredibly, just doing that. So again, with resistance bands.
You're not doing any cardio then?
No, I don't do any cardio.
No. Now, what about, you mentioned your number, that number that was 600, the calcium, and
yeah, the
what
CAC score.
What happened with that?
Well, because of lockdown, I can't go back and have another scan at the moment because it's non-essential. So as soon as I'm able to do that, then I'll be able to come back and report on that. So, I mean, that's a number that's not plucked out of the air. It's a bona fide number of the damage to your arteries, and this way of eating hopefully will either slow the progression or reverse it. So I don't know. I haven't got the numbers to tell you. So I've seen people online that have actually had those numbers done, and they've seen regression from just changing their diet, which is interesting. I'm not a supplementation sort of person. I don't believe you need to supplement. I think food in the main is a good way to go, and I want to try and do it with that. Although in saying that I do supplement with vitamin D in the UK in the winter, and again, going back to my phlebotomy training, I did a couple of winters without vitamin D supplementation, and I looked at my vitamin D levels and my overall health. That's the other thing. People get bogged down with numbers, but you could come in and have a blood test and you could have low levels of folate according to the normative ranges. But if you have no symptoms of low folate and you're feeling fit and healthy, then it's probably not an issue for that particular person. So numbers aren't the be all and end all. It does really matter about how you feel. That's important. And you can have perfect numbers and still feel terrible. But anyway, I digress. Sorry. So the vitamin D, a lot of people don't believe that it does increase when you take a supplement, but it did for me, and definitely made a difference in how I felt. And so I was happy to take that. And also I was looking at a stem cell enhancing supplement, which I think is really interesting. So that's on my Optimal Health website if people want to have a look at that. And I think, we've all got adult stem cells, and anything that can produce more adult stem cells or get them circulating, they're the things that repair your body. So I think that's quite an interesting sort of cutting edge bit of science at the moment,
Mhm.
because we are repairing all the time. I think rest. So although that doesn't seem like much training, 10 minutes, it is to fatigue. And you do then need that day. The reason you do push one day and pull the next is it allows your body to recover. And that's really important, having enough time to repair and recover. I think that's underestimated as well.
And having, because you've gone from, I mean, you have a whole life of athletics, right? So how has your recovery improved? You're talking about the importance of giving the body time to rebuild. How has your recovery time improved between high carb, low fat, and carnivore?
Well, the thing is, hopefully people are watching this and thinking the story is quite interesting. There's a couple of things also to tell you. I used to play squash with some sort of pretty good players. One of the guys who was playing squash for England, and we had a group. And one day I was stretching off the squash court with such severe back pain you wouldn't believe. And again, this was in my 20s. I was shown an X-ray of my hip and told I was arthritic and I would be in a wheelchair by the time I'm 50. Categoric, there was no sort of, this is possibly what's going to happen, which is quite a scary thing to see and hear. I mean, obviously here I am, nearly 57. I was playing football for a local team up until I was in my 50s. So that never came about and I was able to run. And also, I stopped really wanting to talk about this because it is a bit personal, but I lost my hearing as well. So I wear hearing aids and I lip read. And Janice, from your face, I guess you didn't even know that. And one of the interesting things about that is obviously every single year I was going into hospital and having my hearing tracked by audiologists. And then I started, because I was going on a regular basis, getting the same audiologist, same machinery. And so my hearing ability just started going through the floor, really, really, really through the floor. And then when I started eating this way, it started to improve a bit. So that was really interesting. So I'm not saying that this diet will make your if you're hard of hearing or your deafness is really bad, I'm not saying it will cure you, but it seems to have helped, and it has recovered a little bit of my hearing as well. So I'm feeling quite confident that this way of eating is definitely letting my body repair me. I think that, giving it the building blocks to be able to do what it needs to do to fix stuff. Like I say, it sometimes sounds like a magic wand, and sometimes you want to say, well, it is a bit, but it isn't really. All you're doing is saying, right, here's the essential fatty acids, here are the amino acids you need, here's the proteins you need to build things in your body, and we're now going to give them to you unadulterated, and we're not going to put some stuff in that's going to make things worse. We're certainly not going to eat anti-nutrients. And I am definitely stronger. I definitely recover more. So to answer your question, when I was high carb, I had a lot of injuries. I'd be off with bad shoulder, bad back. I had a lot of struggles with my back, which would maybe once every 2 months I would have an injury of some description that would keep me out, or I wouldn't feel quite energized enough to train. I do keep all my figures. The reason I'm looking over there, when I train, I have a whiteboard and I always log my progress on that. And I just got stronger this way of eating. I just got fitter, I'm more energized. The reason I don't do cardio is I don't feel the need to do cardio. My blood pressure is amazingly good. I do all the stats. I've increased my salt, which again, the mainstream media say don't do that. But my blood pressure has just got better and better the more salt I take in. I don't miss carbohydrates in any way. My training is definitely better. I'm definitely stronger. And there are some easy things to quantify. Actually, when I started carnivore, I didn't train exactly how I train. I used to do this warm up, and one of the things I'd just hang from a bar, like a pull-up bar, and I would hang. Which was nice, like a sort of traction thing, really stretches you out, but also it does take strength to hang from a bar. And I would do about 70 seconds. And that was part of the warm up. It wasn't an exercise. And then when I went carnivore, I was still doing that same warm up. And I'd been doing 70 odd seconds for about 2 years, 63, 70, so around that time, or, doing that time most of the time. And within 3 weeks, I was doing 150 seconds.
Oh,
Yeah. And I couldn't believe it because I would write it on the whiteboard and, it's like, 70, 72, 73, 74, 75. And then you'd have a blip of like 86 and it would drop a bit and then it would go back up. And I remember writing it on the whiteboard and going across and then back up because I used to just rub it off and every so often. And I thought, well, I've got to keep this progression up. I wish I'd done a photograph of it. And it went all the way around the whiteboard. And I can remember it getting to 150 and me just thinking, wow. Yes, I think it was 3 weeks. 3 weeks.
amazing.
That's quantifiable, isn't it? Because it's exactly the same thing.
And what about your back then? Because you said, they had told you you would be in a wheelchair by 50 and you were still playing sports on, carb.
50,
How's your back?
perfect. I mean, I'm on no medications. I haven't missed a day's work for years. I haven't been to the doctor for 6 years, 7 years, coming up 7 years. Just the difference is incredible. I'm very confident with my back. I suppose thinking about it, I've never really talked about this to someone that's asked about it. But it used to be a thing I would always have in the back of my mind. And I've just realized that I don't have that in the back of my mind ever.
Wow.
Being stretchered off in my 20s and being told that bad news. And over the period between my 20s and reaching 50, I went back into hospital 3 different times with back pain, severe back pain. That's completely gone. Completely and utterly gone.
That is a miracle if there was ever one. Back pain is such misery for so many people. And then the looming, as you mentioned, the fear, you always have chasing you that your back's going to go out, you're going to be back in the hospital. And it's like the fact that has kind of disappeared from your consciousness is a pretty significant,
Well, the thing is, I mean, that's the other qualification I ended up doing was lower back pain specialism. So I'm a specialist practitioner in diabetes and obesity. And the other thing is lower back pain management. So again, I'm on that list where a doctor could refer a patient to me. Happened to me. The misconceptions are amazing. That's the thing that upsets me the most is they hang around for so long, and a lot of the things that have made my back better are not standard care practice. It's very frustrating basically because there are so many things you can do to improve your back pain. And some simple things as well, and nutrition is a big part of it, because if you're not inflamed in the first place, then that just calms everything down before you even start.
Wow.
And if you are giving your body the right nutrition, it can rebuild, it can improve the bone density. Bone is constantly remodeling. All these things are all known. Your body is constantly rebuilding, constantly. But it needs the building blocks to do that, and it needs the amino acids, it needs the fats to be able to build everything that is building. I mean, the GI tract, I think, rebuilds its entire inner surface every 4 days. So there's constant turnover of production is incredible. I mean, you're looking surprised there, but the numbers are crazy. When I did the phlebotomy, every single second there are 2 million new red blood cells being built. I mean, silly numbers. I mean, it really is building stuff all the time, and you need the right things to build that.
Incredible. And
it is incredible.
So
the body is incredible.
So many people, and I mean, I think your story is really excellent because you were pre-diabetic and you were super athletic and doing just so much cardio and eating all the right things.
Yeah.
So, and I think, diabetes, obviously, so many people are suffering from that. And I know a lot of people who look fit can definitely be pre-diabetic or diabetic. Yes. So what were your findings in terms of how carnivore does affect diabetes management and or prevention?
Well, like I say, I do the weekly diabetes meeting. So So people turn up every week. So I've not lost contact with patients and people that are diabetic and managing their blood glucose. I suppose it seems like a no-brainer that if you are not eating carbohydrates, you will not be spiking your blood glucose. So the number of, so your numbers are easier. That's the thing. So you're not getting this spike of blood glucose, which in turn gives you a spike of insulin to calm down the blood glucose. If you're not doing that in the first place, obviously you need less insulin. So if, just from a medication point of view, you should be needing less insulin. The body uses, another misconception is people think insulin is only in response to food. When you're a diabetic, there's basal insulin injections and bolus. And the basal one is replacing the insulin your body has used overnight when you're not eating. And that's about 40 to 50% of someone's medication. So insulin is used even in the fasted state. And I think people need to realize that it isn't just a response to food. But in saying that, when you start eating, you don't want to be racking those numbers up of the blood glucose. You want to keep that as low as possible. So your bolus, so the things that you're injecting in relation to carbohydrates, those numbers can go down. And as I said earlier in that physiology textbook, your fat burning is switched off in the presence of insulin. So if you have less insulin, there's more chance you're going to burn fat. So you'll be less obese. And I think virtually everybody, whatever way of eating they believe in, seems to understand there is an association between diabetes and obesity. But that doesn't mean if you're overweight, you're diabetic, because you can be thin on the outside, fat on the inside. So there's lots of different things that are going on that can cause you to be insulin resistant. And this way of eating makes it easier to manage. Low carb makes it easier to manage. And I think that seems obvious to me, that if you're not spiking your blood glucose, therefore you won't be raising your insulin. So that surely is a good thing.
And for your own numbers, though, I'm sure you've tested them. So are you no longer pre-diabetic?
Oh, no, nowhere near. My blood glucose measurements tend to be sort of 4.4, which in the States is about 80. You know, it's low. I have a very low level of blood glucose now. I don't feel anywhere near diabetic. So for me, that's not a thing that's going to happen. I can't see that ever being an issue, really.
Wow. And one thing I've always wanted to ask you is, you're incredibly positive and you're always smiling every day and you're glowing. Um, I've never asked you anything about your actual, your mindset, your psychology, going from being high carb, low fat. Were you as positive and perky and optimistic? Is this just your natural disposition, or was there some sort of shift from your fuel?
That's really interesting. I would say this way of eating, I didn't think about this. This is something I've probably realized recently. I'm doing my second degree in my life with the Open University, and I'm finding this one much easier. And I mentioned this in one of the meetings with Sean. And I used to worry about my assessments and things like that. When I did my first degree, I was very unsure, and the things that I was learning, will I ever remember this? Will I be able to pass a test on this and this sort of thing? Whereas I don't have any of those issues now. I think I've always been slightly positive, sort of a bit of a go-getter. I've done some really interesting things in my past because I felt I could do these things and put myself out there. And I've had my confidence knocked a little bit, when I went deaf. That was quite difficult. And I was quite shy about wearing hearing aids. I've now got those ones in the ear, and I feel a bit better about that. Mm-hmm. But I do think this way of eating has made me more positive. I'm definitely more buzzy. I feel a lot more energy. I don't know if it's this way of eating. I don't know. It's a really interesting question, Janice. I don't really know, but I would say I am more positive since I've been eating this way. Things are clearer. I have more clarity. I'm more open-minded. I take new information in much, much quicker. And this isn't my natural. I'm quite a shy person. I know it sounds really weird because I host a couple of meetings and do a lot of this, but I'm actually quite shy. And I would have worried about those sort of things in my 40s, 30s, 20s. But now I feel, I feel a lot more confident and comfortable. And I'm quite prepared to say to somebody, I don't know the answer to that. I have no idea how that works. And I think that's a thing as you get older. And that might be just a thing with age, though. I don't know. But I do think there's been a big step up in the last couple of years since I've gone carnivore. I do feel much more energized and much more positive. I'm not scared of illnesses. And I think the more you understand your body as well and how it works, and even simple things like understanding the medications. When I did the qualifications, you have to study the medications and how they work, or what they inhibit, or whatever, that, you know, the mechanism of action. And as soon as you understand your body and how you fuel it and how to make yourself healthy, and I think most of us, the biggest worry we have is our health. I think most people have, you know, you're going around in this vehicle, you want it to be really good. And there's a lot of, it all makes common sense. That's the thing. When I was younger and I would go to a doctor and they would be ill or overweight or sick, or you speak to a nurse and they'd be overweight and they're telling you how you should eat, you think, well, hang on a minute, you don't look like the picture of health yourself. So what you believe, are you following it? And I think that's the other thing. It's very easy to say, oh, that person's overweight because they have been given this good advice about the low fat stuff, but they're obviously not following it. Well, that's not true now. A lot of the mainstream advice is associated with problems. You know, since we've had the low fat guidelines, we've seen more people being obese. Since we've had the low fat, high carb, eat lots of grains guidelines, we've got more people that are diabetic. So you can't say that's the cause. There seems to be an association between those two things. You know, if you run graphs, they seem to go up together or go down together, you know. So I think it just makes me feel a bit more confident knowing my own physiology and understanding how to make the most of it. I think that's just it. I am positive, and I think the community at MeatRx is particularly supportive, and I think most people in the carnivore community are very open-minded. I think the mere fact that you're eating this way shows you're open-minded and prepared to listen to new ideas. And maybe that's one of the reasons I feel so so hyped up and happy to be doing this sort of thing. And also results. Actually, it's interesting doing these sort of things. I'm not that self-reflective. I tend to move forward quite a lot, but if I look at all the coaching sessions, now when I was a PT and I thought high carb was the way, when you first meet somebody, I would be really happy if they lost 7 pounds, say, for instance. On average, you know, you get a little bit of that. And this is a big problem where people talk about calories in, calories out, because if someone goes from being sedentary to starts doing exercise, they also were obviously thinking about their health, so they're probably making some different choices with food, and they lose a little bit of weight. So they believe the calories in, calories out type of argument. Think, yeah, it is the exercise that's made me lose weight, yeah. And then you see them 3 or 4 years later, and not only have they put that weight back on, but even more. And the more, I know it's crazy really, but the more carbs are reduced. So when I did start doing low carb and talking to people, the weight loss started to be 12, 15 pounds, and it would stay off, and their diabetes medications would reduce. And then when I went keto, the weight loss was sort of 20 pounds, 27 pounds, that sort of thing. And even less medications. Since I've been doing carnivore, you know, I'm not surprised if someone says I've lost 98 pounds. You know, it's huge. People are losing huge amounts of weight and coming off huge amounts of medications, reversing a lot of issues. So, you know, that's going to be positive for me as a coach to hear, you know. And it's crazy. I get people saying, oh, this month I've only lost 18 pounds. And you think, wow, yeah, I would have given anything to have somebody 5 years ago say, I've only lost 18 pounds. You know, it's incredible.
That is amazing. And I want to ask you too about, because when people see you, and I'm still shocked. So you're 56, right?
Yeah.
50. And when I first saw you on the platform, I thought, well, you're what, 56 minus 30 years? Like he's like at you.
That's
So
kind.
I think I would love to ask you specifically about, because a lot of times people come to carnivore. So on Sean's platform, there are a lot of people who are like what, 40s, 50s, 60s, 70s. So what advice would you give to people who are, I guess I would just say already broken, like their body has already broken down because they're older, 40s
Yep.
plus. And what kind of outlook can they expect if they are to shift to carnivore
Well,
when at aging, I guess?
I mean, I've got a huge range of clients, and I'll give you an example. I've got somebody who was 68 when they came to me, and they could barely walk 500 steps over the day. So using their step counter, they had one knee replacement, the other knee was going, and came to me for knee rehab actually, and got him moving and got the pain to be less and less. And sadly, he was talked into an operation because the consultant felt it was probably wise to do it while he was, as fit as he'd been for a long time, which is really sort of strange. Oh, your knee's in quite good condition, so we will operate now. I sort of understand the logic, but I didn't really want the guy to do it anyway, so he did do it. And so he went from low level amount of steps to in 2 years, it's sort of like 12, 15,000. By the way, the knee replacement story is quite common. I've got a couple of clients like that that have had knee replacements. But so anyway, so he had his second knee replacement, and within 2 years now, so he's the lightest he's been in 40 years. So he's now 70. I've got a couple of 70-year-olds at the moment, very similar situations. But yeah, the lightest he's been in 40 years, 12,000 steps, not a problem. Maintains his weight, no problem. Used to be going up and down all the time, fad dieting, yo-yo dieting, cabbage soup, Jenny Craig, Weight Watchers, whatever, he's doing all these things. But now he's almost low carb, no carb. He's probably got a few carbs, can't give up his occasional treats. But he understands it totally. That's the thing. He understands, oh, this weekend I put some weight on because I did this, this, and this. And what I'm going to do is I'm going to do, I'm a big fan of intermittent fasting. So he's going to do 18 hours not eating and then 6 hours eating window. Those sort of things. He's very strategic. But that age, you can do it. Like I said earlier, that I had a woman of 77 didn't exercise, just got better. So I don't think age really is a thing you should buy into. When people say, oh, you get to 40, it's much harder at 40. I don't think that's true. That's not borne out by actual experience with real people. In fact, people in their 40s in particular, the people I coach, are so philosophical and actually get what's going on. I find them easier and they progress easier than somebody maybe in their 20s that's come to carnivore with an autoimmune issue, for instance, because they still haven't got that longevity of experience, and they're still maybe a little bit not skeptical so much, but they've not gone as far as they can trying something and realizing it's a complete waste of time. So I got to 50 and I'd done everything from decades, and where it got me fatter and sicker. So there was no way I was ever going to be convinced that what I was doing was right, because I was an experiment. I was, an N=1 experiment, and it didn't work for me. Everything was falling apart. So I think when people get to their 40s, they probably tried things, they've tried, it's not knocking this way of eating, they've probably tried vegan or vegetarian or soy only, or, calorie restriction. And it's not worked, because that's why they've come to this way of eating. I think something like with vegetarians, I think 80% give up within 3 years because of health issues and stuff like that. So I don't think age is that much of an issue. I think you could come to this in your 80s and get improvements. I certainly think you would improve your muscle mass and bone density, and they're huge factors in things that make sure you have good overall health. So, for instance, bone density. Why is that important? Well, if you fall and you're more likely to get a fracture, then that's quite serious when you're older, because that will mean you're going into hospital and there's possibility of infection. So if in the first place, if your bones are more dense and you fall, well, firstly, there's less likelihood you will fall because you've got that increased muscle mass. But let's say you did fall, then you're more likely to not have those issues. You probably won't get a fracture. I mean, bone isn't a dead piece of chalk. I mean, it is a live, living part of your body. 50% of it is collagen. It's all flexible. So the more protein you're giving it, the more chance that you can get that collagen matrix to rebuild. Then that bone is going to be more flexible, less likely to fracture. And going into muscle mass, that's going to mean that it's easier for you to move around, be stronger, like I say, less likely to fall. Your balance probably will be better, and just your overall strength will be good. Muscle is associated with longevity. That's something that seems to come up all the time, that those with more muscle mass tend to live longer, or not only live longer, but also be healthier. So you can do this at any age.
And so you would say that the carnivore diet is a diet for longevity then?
No, well, we can't say that. There's no studies that show that. I think if you look after your health and you have maximum efficiency or most optimal health, if your bone density is good, your muscle mass is good, you're feeding your body the right way, then the chances of you living a long, healthy life are improved. That's what I would say.
That is so wonderful, Stephen. Thank you so much for this. This has been an excellent and amazing, enlightening conversation. I feel like you've given people so much hope for the carnivore way of eating and how it can improve our health and fitness. And also just the fact that we don't need to be gym rats. We don't need to be exercising all the time and doing all this crazy cardio. That is such a freeing concept to know that, we really don't have to do as much as we think to be in optimal health. So are there
yeah, I mean, you shouldn't need to exercise to stop your body putting fat on. If you are exercising to stop your body putting fat on, then you're eating the wrong way. I mean, it really is that straightforward. You should be exercising as sort of the icing on the cake, which is not the best analogy when you're talking about carnivore, but the best thing you can do is to eat well, make sure that your body's not putting fat on in the first place, or it's losing the fat that you've amassed. Get yourself into a nice shape, and then the exercise is just something additional for overall fitness, movement, making your joints better, your balance better, your proprioception. Everything will be improved to a greater degree if you're exercising, but without that solid foundation of really good nutrition, you're not going to get the best possible health outcomes.
That makes so much sense.
That's okay.
Thank you so much, Stephen. And we are going to include in the show notes how you can reach Stephen for if you do want to work with him as a coach, either through MeetRx or through his other platform. It is available via Zoom, right? You can do, even if we're on the other side of the pond or anywhere in the world, people can coach with you, right? Or work with you, right, Stephen?
Okay. Yeah. Thank you for that. That's good. Yeah. I've got clients in Australia and Canada, America, obviously here in the UK. So yeah, can see anyone anywhere.
Wonderful. The beauty of Zoom, right?
Thank you, Janice, for inviting me on. It's really good. And what you're doing with the Confident Carnivore, I think it's a fantastic website. I'm really impressed with all the podcasts and the coaches you've had on and the people you've had on. Been really interesting. It's just great to hear everybody's story, and I just think it's such a brilliant thing you're doing. So I'm really quite honored to be asked to do this. So thank you very much.
Well, thank you, Stephen. We're so honored to have you. And I was so excited when you said yes, because I knew that you would provide, as you did, just such a wealth of information. And you explained everything so clearly. And I know people are going to get a lot out of this conversation. So thank you so much. And hopefully we'll bring you back another time to cover some more topics. So have a great evening, Stephen.
Thank you.
We'll see you soon. Thank you.
Have a great day. Thank
You
you.
too.
Bye-bye.
Bye bye.